Great, and I really took away from that presentation also the word cyberchondria, which my family clearly suffers from. So I'm looking forward to using that at home as well as these apps as they evolve. Now, as we plow on, as we head toward the finish of the morning session, we're going to shift gears a bit and go back to some announcements and the so-called action beats. And in that spirit, I want to invite John Lumpkin, the Senior Vice President at the Robert Wood Johnson Foundation, to the stage.
Thank you. Good morning. The Robert Wood Johnson Foundation is pleased to be here as a sponsor of this Datapalooza. And we're pleased to share with you why we as a foundation believe that what's going on today is so important. I'm reminded a little bit of some of the work of Michael Wolfson from Stats Canada, who talks about the fact that when you have data and you analyze it, you create knowledge, you create information. And if you put that information into context with rules, that you actually have knowledge. And so that brought me to the works of T.S. Eliot, who said that the endless cycle of idea and action, endless invention, endless experiment brings knowledge of motion, but not stillness, knowledge of speech, but not of silence. And he went on further to pose these questions. Where is the life that we have lost in living? Where is the wisdom that we have lost in knowledge? And where is the knowledge that we have lost in information? And I might pose that today we should ask, where's the information that we have lost in the data? So he asked the right kinds of questions, and when we begin to look at some of the data that we have, and for instance, let me, for example, take this data from the CDC website that talks about notifiable diseases, and focus you in a little bit on just one, cholera. And you look at the rates of diseases within cholera, and you see that there are reports from 2011, you see the most recent reports where there are in fact no cases. But does this actually give an accurate picture of what's going on in this country? I struck that in just actually over 150 years ago, John Snow, for many of you who may not know, is the father of modern epidemiology, looked at an outbreak of cholera in London. And he used a graphical information system, a very powerful one. It's called a map and a pencil. And he plotted this outbreak of cholera. And what he did is he took that data and he made it visible and understandable. And he presented it to the fathers, the city fathers around Broad Street. And he was able to convince them to remove the handle from the pump. And he was able to end that outbreak of cholera. Now, we have a lot of data in our lives, with more than 300 million photos being updated to Facebook every single day, with 3.2 billion likes and comments being generated by Facebook, 340 million tweets per day, and 115,000 people on Patients Like Me. The amount of data that we have is staggering. Carl White, who was the chairman of the National Committee for Vital and Health Statistics in 1974, commented that with the advent of new technology, data can be collected in any format, aggregated by the computer and arrayed in any desired output, and collecting masses of data untouched by human thought. We at the Robert Wood Johnson Foundation believe that data should be a tool. And that as such, you've heard about the presentation earlier today about the county health rankings, and we've been pleased to work at the University of Wisconsin in helping to fund this very important initiative. Another initiative that we have where we believe that data is critical is aligning forces for quality. There we work with coalitions of consumers and purchasers and payers and providers of care to do public reporting of quality and price information and use that to drive change, to engage consumers, to visualize that data. And as part of this program, we're proud to have been a participant and a sponsor of an app challenge. This app challenge sought to take this information that's being collected by each of these 16 regions that are engaged in quality improvement and to make it meaningful for consumers. We started out with 55 entrants, and I'm pleased to have the opportunity to announce our finalists. The first is Ringful Health with Michael Wan and Doris Peter. And this organization, Ringful Health, is working when partnering with Consumer Reports to develop an iPad solution to not only disseminate, but also collect hospital data by engaging hospital inpatients. The second one is somebody you just heard from, SimCat. And there, Craig Monson you heard from, but also David Doe are the leaders of that initiative. And the third one is of Flexus Void Span, and they'll be around today. And Andy Kogelnick and Kenneth Ng is developing a cloud-based solution combining telephone, SMS texting, fax, web, and mobile access into a single integrated solution to put patients and providers in front as the drivers of quality care. So it's my pleasure to announce the award winners. In third place for the $5,000 award is Ringful with Michael Wan and Doris Peter. In second place for $25,000 is Flexus with Andy Kogelnick and Kenneth Ng. And in first place with the $100,000 prize is SimCat with Craig Monson and David Doe. And we have here congratulations. Now, you can't spin this one, but we do have a real one for you backstage. Thank you.